Well, thank you very much. And first of all, welcome all to our Moonshots conference. And I was just told that we have nearly 4,000 healthcare executives registered in our audience today, which is quite exciting. And I'm even more excited to kick things off with the keynote speaker that I think will set the tone for this entire conference. So I'm very delighted and grateful to have Dr. Mark Hyman, the co-founder and chief medical officer of Function Health, a personalized health testing platform to help people live longer, healthier lives, here with me today. And to conclude my introduction here, Dr. Hyman is also the author of not one or two, but 15 New York Times bestselling books. He's also the host of the podcast, The Dr. Mark Hyman Show, as well as the founder and chairman of the Food Fix campaign, which aims to change the food and agriculture system through policy. And I personally know he truly cares about health. And if not too soon to say, he cares about making all Americans healthy again. So thank you so much for joining us here, Mark. So I'm excited to have you here. Okay, well, Mark, we'll kick off with a softball question. So let's talk about the big picture and the potential root cause of diabetes and obesity, and maybe more broadly, metabolic disease. I think all of our listeners here today know that our country's spending on healthcare is up and up and up, but our health outcomes are largely worse, so going down. And I think we would also agree that the cost of metabolic health is largely driving those costs up. So, Mark, how did we get here? What's really driving the rise in metabolic disease? Did we just all get lazy a couple of decades ago and started eating more, or what's happening?
No, no, not exactly. When you look back historically, back at the records, for example, in Mass General in the 1800s, type 2 diabetes was almost non-existent. In the turn of the 1800s, we had maybe 10 pounds of sugar per person per year, which is a lot, but now we have about 152 pounds. We also started refining flour and carbohydrates, which was new around the turn of the century, and that led to a whole widespread deficiency disease epidemic of pellagra and beriberi, which is why they fortified grains and cereal and flour with nutrients, the B vitamins, to prevent these deficiency diseases from refining carbohydrates. And we eat about 133 pounds of refined flour every year. So you combine that together, it's almost a pound of sugar and flour per person per year in America. A pound of sugar and flour per person per day in America. And that is a pharmacologic dose. And they're really below the neck. There's no difference between a bagel and a bowl of sugar. And so what's happened is that, we really accelerated over the 1950s the production of industrial agriculture, as many calories for a growing world population, and that inadvertently led to the massive production of starch as a key calorie conform. And then we ended up in the 1970s with the McGovern report and the food pyramid in 92 saying we should be eating 6 to 11 servings of bread, rice, and cereal and pasta. When you look at the inflection of metabolic disease, prediabetes, type 2 diabetes, it was right then in the sort of late 80s, 90s. And over the last 3 years, we've just seen, incredible growth in this very rare disease. I mean, even in China, they went from 1 in 150 to 1 in 10 just within the last, decade. So it's happening globally, and it's something that's completely preventable. And historically, we weren't adapted to these pharmacologic doses, and our bodies are designed to crave and like sugar because anything sweet is safe to eat. So if you found a fruit or something, as opposed to something bitter, it could kill you, if you're hunting and gathering. So our bodies are tuned to actually store fat, to use insulin, which is a fat storage hormone, to put away stores when we get access to large amounts of carbohydrates, whether it's from flour or sugar or any form. And I say those, I mean kind of globally. There's not like honey is better than maple syrup is better than coconut sugar or better than sugar. I mean, there's some slight differences, but sugar is sugar. And we also increase the fructose content of our diet, which is also particularly bad in terms of driving type 2 diabetes, epidemic. High fructose corn syrup and is in everything. And it's I think 5% of corn that is made is actually used to eat like corn on the cob, but the rest is basically for either animal feed or for industrial food production and high fructose corn syrup. So that's really the reason. And so there's a whole group of people who are more prone to being carbohydrate intolerant, as we heard from one of the members of Verta, that she realized she was carbohydrate intolerant. It's kind of a new concept, but there is no biological need for carbohydrates. We have essential amino acids, we have essential fatty acids, but there are no essential carbohydrates. So people can go on a ketogenic diet and live just fine. And in fact, that's what we did historically as hunter-gatherers. We'd go keto when there was not much around, and then we, pig out on the berries in the summer and get a little fat, and then we survive the winter. But the problem here is we just keep eating all winter. And I think, we are now seeing an incredible crisis with, I think it's like $480 something billion being spent in direct costs on type 2 diabetes. When you calculate in pre-diabetes and obesity and all the complications from all these conditions, it's driving the majority of the $4.8 trillion we spend on healthcare. It's actually 40% of that bill is paid for by the U.S. government through various programs, and it's $1 in $3 of our federal budget. And right now, Robert F. Kennedy Jr. is getting his hearing on chronic disease in the U.S. Senate in the Finance Committee, and is talking about a lot of these issues. So I think for the first time, I think in history, we're at a moment where this is being recognized at a federal level. I've been working at this for over 30 years, trying to get people to talk about it, trying to have it in the presidential conversations. But I mean, the fact that President Trump, whether you like him or not, he talked about chronic disease in his inauguration speech, I think is really consequential. And so, we've got to tackle this because it's going to ruin us.
Yeah. That's fascinating. So basically, you're saying that the food environment has fundamentally changed, which is driving metabolic disease. It's not that we woke up on a Monday and said, let's all eat too much and get sick. And by the way, that statistic, I wasn't aware of that, but that's insane. That on average American eats more than 1 pound of sugar across
probably
a day. By huge numbers. I'd be very tempted to jump into sort of the food as medicine right away. But before we do that, I do want to touch on the topic that you can't have a healthcare conversation today, at least I haven't been able to, without mentioning it. That's the GLP-1. So before we go into food as medicine, and by the way, we have many GLP-1 sessions in this Moonshots conference today and tomorrow. But so many people, we view GLP-1s as kind of like a fundamental breakthrough in treating obesity, if not a miracle solution that we all have been waiting for, and maybe for good reason based on outcomes. But I'm curious, what is your take on GLP-1s? Are they the obesity cure? And are they really addressing the root cause, or more like a symptom, high blood sugar and excess weight? So what's your take on GLP-1s? And obviously we could talk about 2 hours about this, but I'll give you a chance to talk about it.
Well, I always harken back to this article in the New England Journal of Medicine where they said, be sure to use new drugs as soon as they come on the market before the side effects develop. So I think we're seeing, that there's both benefit and there's potential harm from these drugs, like any medication. It's not, the panacea, because it has consequences. And it can be incredibly helpful for many people. I think if combined with a high protein diet, about a gram per pound of ideal body weight. So if you're 200 pounds, that's 200 grams of protein a day, plus vigorous strength training at least 3 times a week, it can actually be a great tool to help some people lose significant amount of weights and actually get their metabolic health in check. And for people who struggle, it's tough. And I think it is a solution. But what I worry about is, one, the consequences of the doses we're giving, the need for the high doses, the current formulations, they're peptides. So they're not actually patentable, except in the delivery mechanism. So basically what you're paying for is a $1,700 Ozempic pen, as opposed to the drug itself, which you can buy for $20 a month online from a peptide supplier, which is a whole other conversation. But there are compounding pharmacies that actually make these peptides, and you can get them for pennies. And actually, it's actually lower doses may be effective. Different dosing schedules and regimens may be effective. But I would say this: there are billions of dollars being spent literally on research funded by the pharma companies that make these GLP-1 drugs and other ones like tirzepatide, and looking at how they can be used for every possible indication, from depression to autoimmune disease to dementia to cardiovascular disease to obviously diabetes. And it's almost like a gold rush, and they want to kind of get every indication. And the question really is, if you look at that cohort who's getting those treatments and compare them to somebody who's, for example, on a ketogenic diet, or who had a very low glycemic, high fiber, high fat, higher protein diet that wasn't necessarily ketogenic, how would they fare, and would they have the same outcomes and results? And I believe the answer is mostly yes. I think there may be some effects of the GLP-1s that we are learning about that might be beneficial for inflammatory conditions, autoimmune conditions, that may be different than just the weight loss. So for example, I had a friend who's taking a very low dose right now. She's got an autoimmune condition and eczema, and it's like completely taken it away. So I'm not saying that they're bad. I just think we need to be more judicious in their prescription. I don't think they should be prescribed without the high protein requirement and the strength training requirement, and they should be probably done at lower doses. And I think we should be able to kind of track patients with DEXA scans and make sure that they're healthy. So I think the way it's being done, just everybody getting it for losing 10 pounds, I think is a bad idea.
Yeah. Well, thank you very much. And in many ways, as you mentioned, the truth is often in the middle, meaning the GLP-1 sounds like a potentially useful tool in a toolkit addressing obesity and metabolic disease, but may not be the one and all miracle cure. But as I mentioned, there's going to be many conversations about GLP-1s over the next 24 hours in Moonshot. So hopefully people can tune in and enjoy those conversations. So let's talk about food as medicine. You alluded to the fact that food environment has changed, and that's kind of fundamentally driving metabolic disease, and also talked about some of the macronutrients and sugar and so forth. But two-part question. One, as you are a strong advocate for food as medicine, can you dive a little bit deeper? What is your philosophy or scientific sort of background? So how should we think about food as medicine? And again, not necessarily going into the very details of what should I eat today, but a little bit deeper than in the introduction. And then secondly, which surprises me is, despite this mounting evidence that we can address and improve, and in many cases reverse disease like we do at Verda for type 2 diabetes, some of the medical and scientific community is still kind of very skeptical, and a lot of cynicism towards this idea that you can use food to address or reverse chronic disease. Why is that? So two-part question about food as medicine.
Okay, I'll address the second part first. Sure. I'll do the first part second. I think the real reason is that, one, doctors learn nothing about nutrition. Two, if food is medicine, you have to have the right drug and the right dose and the right frequency for the right duration. And I think what people often see as physicians, when physicians often see, is they say, well, I want you to improve your diet, eat less, exercise more, eat healthy, have balanced meals, follow the dietary guidelines, whatever they tell them. And they see it doesn't work. And they go, well, diet doesn't work. It doesn't really have that much of an effect. And they don't understand that it actually is more powerful than medication in many instances, and it can do what medication cannot. And I think it's the absence of actually seeing that, of learning about it, and of understanding it. So, if you were living in, 1900, and you heard about a heart transplant, and like, you go, no way that's ever going to happen. But, in this day and age, heart transplant routine. So it's the same thing. We kind of don't really get the power of this particular tool. And when I think of food as medicine, I think of it not in a metaphorical way, but in a pharmacological way. That different foods have different properties, from macronutrients, different types of macronutrients, like there's different fats that they're not all equal, or different acids and different carbohydrates, they're not all equal. And they also have phytochemicals, which are modulating all sorts of physiological responses and gene expression. And they have micronutrients, vitamins and minerals. So there's many things in food that all interact with your biology beyond calories. So I think historically we've seen food as just energy. This is, I'm eating to fuel my body. But the clarity that we have now about the composition of your diet and its influence on hormones, on your microbiome, on your immune system, on your brain function, on pretty much everything you could possibly think of, from gene expression to detoxification to mitochondrial function. These are all regulated by the food we eat. And so from my perspective as a physician, and I've been using food as medicine for 30 years, is there's no like, here's the diet for this problem. Like, for example, for type 2 diabetes, a ketogenic diet is a powerful tool, but it might not be the best tool for someone with another health issue. And they need a personalized prescription of nutrition based on their particular genetics, their current health situation, and it's really a customized approach. So I think the idea of food as medicine is coming to fruition. I think people are understanding this. There's food as medicine working groups in Congress. There's the Food as Medicine Institute now at Tufts. There's a lot of work being done in Washington to try to understand this, but I think people still don't quite get it. There still is thinking, oh, this is prevention. If I eat healthy, I'll prevent heart disease, I'll prevent cancer, I'll prevent dementia. But there isn't an understanding that food is actually a treatment. And that is something I really struggle to try to communicate, is that lifestyle and food are medicines, and they work better when combined together than drugs. And just a quick anecdote, I had a patient at Cleveland Clinic who, was severely obese with a BMI of 43. She had heart failure, multiple stents. She had type 2 diabetes on insulin. She had hypertension. She had fatty liver. Her kidneys were failing. She was on $20,000 of copay medication. And it sounds crazy, but just doing not a keto, even just what I call my 10-day detox diet, which essentially is very low glycemic, no grains, no beans, and no dairy and sugar. And she lost about 43 pounds in 3 months. In 3 days, she was off her insulin. She got off all medications in 3 months. Her A1C went from 11 to 5.5 in 3 months. And in a year, she lost 116 pounds, no medications. She got, I think, a multivitamin and vitamin D, and saved, I don't know how many untold tens of thousands of dollars from Medicare from all her medications. So, and hospitalizations and doctor's visits, and the list goes on. I mean, there was just a food as medicine trial that we did at Cleveland Clinic where we found we saved $12,000 per patient annually. Like, that's an astounding amount of money by simply providing them meals to help control whatever particular conditions they have. So I think that we're in an era where we can't keep piling on drugs, which just mitigate symptoms, but don't address the root cause, which is our diet.
Yeah. Before we go into sort of health equity and access to food, which obviously is a component of food as medicine, let's talk about the dollars and cents. You mentioned there that I think it's easier for people to understand to use food as medicine to prevent disease. It's harder for most people to maybe believe that you can actually reverse or treat disease. But as you described, and obviously we at Verda have been doing reversing type 2 diabetes and even taken very late stage patients living with type 2 diabetes on insulin. And I think
exactly.
Did a video last, Michael, this gentleman, Verda member, lost, was it 260 pounds, something insane.
Crazy,
but
right?
It is possible to
like 2 people.
Late stage disease. But undoubtedly on a societal level, the earlier we can address, more lives we will save and more money we will save. So if we can invest and address the prevention side of things rather than these remarkable stories of reversing late stage disease, which again is possible. I'm curious from your perspective, one challenge obviously in the US healthcare system is that if you're a coverage decision maker, investing into something that may show savings and better outcomes 5 years later is kind of like, well, why would I do that? Because the other insurance company or the other employer is going to benefit from my invest into prevention. So I'm curious from your perspective, is this a mindset problem or policy problem, or how could we put more money and effort and resources into the prevention side of things, which again on a societal level probably is the better investment, but from an economic perspective, you may not see the 12-month or 18-month or 24-month ROI.
Yeah, I mean, this is a perennial problem in how our healthcare system is designed, which is that people change jobs, they move, they're mobile, they change insurances, and so an insurance company doesn't want to invest in the long-term health of the member. They just want to reduce whatever payments they can and restrict access. I recently had surgery, and I needed healthcare, and it was a back surgery that was pretty serious, and I needed rehab after, and they refused to pay for rehab. So, I was like, so the insurance company, they're trying to like not pay when they can, and the incentives are all wrong. So I don't know the answer, but there's got to be some creative solution where there's portability and there's shared kind of profit from making people healthier rather than just raising premiums. Because right now it doesn't matter. Insurance companies, if people are sick, they just raise premiums, they cover it, they keep their bottom line or even increase it. So I think that there's got to be some shift in policy that helps us sort of bring this issue to the forefront and help really incentivize the right behaviors from payers. And I think that's really what we need. And I hope with the new administration there can be some inroads in that. But it's definitely something I think I'm close with Dr. Oz. I've known him for over 22 years, and if he gets confirmed as the head of Medicare and then or the Center for Medicare Services and Medicaid Services CMS, I will work with him to help sort of think about these problems and try to bring the best minds together to solve it, because it is a vexing problem, and it prevents people from having the right kind of care.
Yeah, and then honestly, it's been a little bit of a personal frustration for me as well. And the reason our Verta business model and focus has been on treating the sickest is not that we can't help also the people who may have prediabetes or kind of early metabolic disease, but it's the economic reasons that our clients are mostly looking for the highest possible ROI and savings. But it's exciting to hear that you are investing your times and efforts and energies into improving policy as well.
Maybe a dumb idea, but I'm gonna try.
Here's to hoping. Let's talk about equity. So oftentimes when we talk about reversing chronic disease, diabetes, obesity with nutrition, the question comes up, well, wait a second, not everyone can go and shop Whole Foods and buy organic vegetables and grass-fed beef and eat the perfect kind of diet that is usually, or oftentimes the perception of using food as medicine. And then that's a real question. What is your take on how do we make sure that everyone, or at least most people, have access to sufficiently healthy food? And then also, are there ways for people to take the first steps towards addressing metabolic disease with nutrition, even if they only have access to, let's just say, convenience stores and maybe less high quality foods? What's your take on that?
Look, I think what we have is a society where 60% of our diet is ultra processed foods, basically factory-made science projects, which have been shown to increase appetite, to dysregulate the microbiome, to increase inflammation, linked to dozens and dozens of diseases. And we can kind of nitpick about the definitions of ultra processed food and what's good and what's bad. But on a whole, the concept is, I think, a useful concept. And that's really the problem. And kids at 67% of their diet. So there's a hierarchy. Eating just real food is the basic foundation of getting healthy. And I had my eyes open quite a bit because I think, the food industry is very good at kind of deflecting and saying, oh, it's elitist to say to eat healthy, it's expensive, you're discriminating against the poor, we're the good guys, we're helping them have safe and affordable processed food so they can get their nutrition. And it's if you just eat less and exercise more, ignore the fact that 14% of adults and I think 12% of kids are biologically addicted to food, not just kind of craving it once in a while or wanting that cookie, but like literally biologically addicted to food, which is the same number of people that are addicted to alcohol. If you look at that whole thing of ultra processed food, you just remove it from your diet, you can have a profound impact. And I'm on the board of the Environmental Working Group, and we have a guide called Good Food in a Tight Budget. And I was part of a film 10 years ago called Fed Up. I think it's on Netflix. And it's essentially about childhood obesity. But in the film, I went down and visited this small town in Ely, South Carolina. I met with a family of 5 who lived in a trailer on food stamps and disability, $1,000 a month to feed all of them. And, all they ate was processed food. The mother was, huge, plus 200 plus pounds. The father was 42, already on dialysis from type 2 diabetes at 42. The son was 16 and probably, was actually 50% body fat. Should be 10 to 20 as a young man, or as any man. And I said to them, look, let's go through your kitchen and we'll see what's there. And I showed them. They didn't even know all the harmful ingredients that they were eating. They didn't know about high-fructose corn syrup. They didn't know about trans fats. They didn't see the additives. We thought, was labeled healthy on the label, so it was good, which is another big problem we're trying to solve with our FDA labeling issues, which I think the new ruling actually has helped that, or the proposed rule. And I said, let's not like kind of lecture you on what to eat or anything. Let's just cook a meal together. And we've got, simple ingredients that were inexpensive, beans, whole grains. You can get, cheaper cuts of meat or chicken, cheaper fish. There's cheap vegetables. Like the other night, I made something my mother used to make all the time, which is cabbage soup. So it's like onions, carrots, cabbage, short ribs, which is the cheapest cut of meat. You throw it in the pot, with some apple, lemon, and like it's an incredibly hearty, very inexpensive meal. And I didn't make it because it was inexpensive, because I could afford to eat whatever I want, but I ate it because it was delicious. So, I showed them you can make delicious food like a turkey chili. We made sweet potatoes in the oven. We made salad dressing from scratch. We stir fried vegetables like asparagus. They'd never ever done that. And then the family lost a huge amount of weight. In the first year, they lost 200 pounds. The son ended up losing 50, gaining back because he went to work at Bojangles. But then eventually he kind of wanted to get back on track, and he lost 132 pounds with me coaching him. And he ended up going to college, first time anybody in his family went to college. And then he finished college and asked me for a letter recommendation to go to medical school. And now he's a doctor. So I think, when I think about this kind of propaganda of it's elitist, expensive, and unaffordable, they lived in one of the worst food deserts in America. They were extremely poor, and they were able to do it. So it's really more about education and about training. And we've eliminated home ec. We've eliminated it. I mean, we've disenfranchised people from their kitchen. We have delivery, we have Instacart, whatever, but people don't actually know how to cook, and they don't have dinners as families. We sort of disrupted the American kitchen. So the food industry has really hijacked the American kitchen, and they've done it through a whole series of very deliberate attempts. Do you deserve a break today? Like convenience is king, and that's really the values they try to instill in us, much to our detriment.
Yeah, I love that, and love that attitude, education and training, and there's always a way. And maybe sometimes the let's not let the perfection to be the enemy of progress. And we work with a lot of tribal nations and Medicaid populations, and exactly what you described it. We may not be able to help get access to the perfect food, but there's always a way through education and training to do something. Okay, so one quick question. I think we have 30 seconds. One quick question, like, what one or two policy changes would you like to propose that we can improve the default food environment? As an example, obviously, the red dye was recently banned, which is good progress. But what one or two policy changes would you like to see that we could improve the default food environment? And then we'll wrap up this fantastic conversation.
There's not like one magic bullet, because there's so many different things. We have to change from field to fork everything we do, how we grow food, what we grow, how we incentivize what we grow. But I think one of the most powerful levers is education. And people, for example, front of package labeling is a huge thing that can be implemented by the FDA to make it clear about what you should be eating that is healthy versus not healthy. Right now, it's super confusing. Also, I think that we should be reimbursing for food as medicine within Medicare, and that will sort of move things forward. We actually just passed a provision in in December at the last Congress of my nonprofit that is going to be paying for medically tailored meals in Medicare. So we're kind of moving the ball forward on that. I think our dietary guidelines have to be really updated and be disseminated. So I think right now there's very little money for dissemination and education. So the American public needs to understand what's happening. And when they do, they're like, holy cow, like, I don't want to eat microplastics, or I don't want to have, red dye number 3. I mean, nobody wants to do bad stuff to themselves. So it's just a matter of education. We have 10,000 chemicals in our food in America. There's 400 in Europe. We should just adopt the European standards and call it a day.
Fantastic. And thank you, Dr. Hyman. Very informative, very inspiring, and hopefully we'll make America healthy again. So thank you very much.
Thanks so much for having me.